Clark.
Deputy Speaker, I thank the member for Fowler for bringing this important matter before the House, because access to quality, affordable health care is a fundamental right and it shouldn't be dependent on your postcode. But sadly, that's the case, because the postcode lottery is the daily reality for too many people in this country, particularly in my home state of Tasmania. Now, Deputy Speaker, I do acknowledge that this situation is in part due to health policy and funding being a complicated and shared responsibility between the federal and state governments. But that doesn't mean the difficulties being experienced by the community can't be solved, nor that we should accept the situation when specific challenges seem to be intractable. And boy, oh boy, aren't there some challenges to confront right now? Indeed, as I speak with families and healthcare workers in my community, and indeed right across Tasmania, I hear the same concerns repeated again and again, that GP clinics are overbooked, that bulk billing is still difficult to find, that facilities are outdated, that emergency departments are cramped or overflowing, that diagnostics are limited, and that way too often essential care is delayed. Deputy Speaker, at the start of this year, GP bulk billing across Tasmania was up more than 5% to 80% compared with 12 months ago, due to the government's boost to incentives. And that's great. But to be honest with the community, that improvement's off a low base, and Tasmania remains the second lowest bulk billing state in the country, well behind New South Wales and Victoria. Moreover, the figure is distorted by improved rates in rural areas, leaving the actual bulk billing rate in Hobart somewhere between 60% and 70%. And all that's despite Tasmania having one of the oldest, poorest and sickest populations in the country. And as the Grattan Institute notes, boosting the bulk billing incentive does have the perverse side effect of entrenching a dysfunctional funding model which incentivises practices to see more patients for shorter visits, regardless of a patient's needs. This leaves GPs feeling overstretched and unable to meet patient needs, and leaves patients without the time and support to properly address increasingly complex and chronic conditions. Now, Deputy Speaker, it's not just primary health care that's shack-baggally in my home state, because acute care lags the rest of the country too. For instance, in Tasmania, hospital emergency department waiting times are markedly worse than the national average, with the latest data showing that the state recorded the worst results in the nation for emergency department performance. In fact, only 46% of patients were seen on time in 2024-25, compared with the national average of 67%. The goal, of course, should be 100%, and that's if you actually manage to get to the ED, because Hobart has the longest ambulance response times of any state capital in the country, so that across Tasmania last year, more than 4,500 emergency incidents had to wait more than 35 minutes for an ambulance to arrive, and that's just shameful. Meanwhile, Deputy Speaker, the public mental and dental care system remains in dire straits in Tassie too. In fact, if you're on the wait list for the public dentist, you're likely facing a wait of about 4 years. This is, of course, not because our healthcare workforce isn't doing their best. No, they are highly professional and do an excellent job under a huge amount of pressure. But they do need to be properly supported by a funding model and a healthcare system which works no matter where you live. And, Speaker, that's something we should be able to provide in this country. Now, I've said it many times before, that Australia is one of the wealthiest countries in the world, and if we decide something is a priority, then we can afford it. Indeed, according to the latest UBS Global Wealth Report, Australia ranked second in median wealth, behind only Luxembourg. And in the last budget, the government had over $750 billion on hand to spend. In other words, it's all about priorities and teamwork. Deputy Speaker, so instead of each jurisdiction wandering around like Brown's cows on healthcare policy and funding, they should be working together with the Commonwealth to ensure that no matter what your postcode or where you are in the country, you can be assured of access to quality and affordable health care when you need it. Thank you, Deputy